On last week's episode, we talked about protecting the pedophile. And of course, amidst all this, we talked about situations where we always have to let pedophiles or sexual abuse perpetrators on children go scot-free. And this week, we'll be discussing one of the major reasons why people don't get convicted when they abuse children. And that is the availability and viability of medical records for sexually abused children. On this episode, to discuss some of these challenges, we have with us a medical professional in person of Dr. Chika Dinaka Ezokeke. You're welcome to the show, ma'am.
Thank you very much.
Welcome.
Thank you.
Good to have you.
Yeah. Nice to be here.
So, without taking much of your time, we want to know, like, how often do we get to see people report sexual abuse cases?
From my experience in the clinical setting, most of the cases reported actually for children, basically, are parents of affected children coming to report, of the sexual abuse. We hardly see adults, so mostly we see parents coming to report mostly, and it's not very prevalent. So you can have like one or two cases in a very long run. So not very
Why do
common.
you suppose that happens?
I suppose the reason why the prevalence of the reports of child sexual abuse is actually low is because of the social stigma of having to have a child who has been sexually abused. Even when they even report it to the hospital, they are doing it, if they want to be private, they don't want anybody to know about it. They are doing it silently.
Hush,
They don't
hush.
even want, like, hush hush. They don't even want the street to know about it. They don't want anybody to know about it.
So, in situations like that, that means they're not even pursuing justice.
At all.
They're not pursuing
There
justice.
is something else I want to ask. Dr. Chika,
Yeah.
the way it's done in our own area of profession is that when an incident of child sexual abuse is reported, the first point of call is the police station. You report to the police, and then the police takes the child to the hospital where the child can be examined. Now, when such a situation comes, a victim is brought to your hospital, what is the next? Do you ask if the case has been reported to the police, or do you just examine? And apart from that, what are the necessary steps that the hospital takes to make sure that the document or the test or the examinations being conducted are kept in such a way that it can be used as evidence in court when the need arises?
Okay, basically, in the hospital setting, what we do is we examine the patient. That's our point of call. Most of the cases that we see in the hospital are brought in by the police officers.
Okay.
Yeah, so in those situations where the police officer doesn't bring the case and you just walk into the hospital, you notice that most of these people just want to be private. They just want to check and they don't want to report the case. We've had a case where the father was molesting the child and it was found out. The family didn't want to prosecute. They didn't even want the police to know.
This was exactly what
So-
we did our last episode. They protect. They want to protect.
Yes,
Yes.
they want to protect the criminal, the person who is the abuser,
Perpetrator.
the perpetrator. So in such a case, it's not in our line of duty to want to report the case. What we can do is to invite child welfare,
Okay.
where we have such, and then we invite the counselors to counsel the child. What we stand for is the overall health of the child. So if they don't want to, and we notice there's an iota of trying to hide the perpetrator, what we do is invite this child welfare. Child welfare can now determine if they want to prosecute this case or not. Now, after that, the one thing you want to do is to ensure that child doesn't have post-traumatic stress disorder. Child is sane and can act well and also doesn't lose self-esteem because of the act. So the next thing we do is to ensure that the child is counseled and guided how to come up. Most of children actually are even at the age where they don't even know what is even happening. So at that point in time, it's the parents that will be counseled on how to guide that child. But if the child is old and have a grasp of what is happening, then you have to talk to the child and get the child to know that this is bad and we shouldn't continue, and educate the child more on how to actually stop or what to do when such things happen. Now, after that, now it depends on for the giving evidence to the police. Now, when the patient comes, what we do is that we collect samples from the patient. We actually examine the whole genital area for any signs of forceful injury or trauma or penetration. Now, one challenge we have is that most patients come in late. So by the time they are presenting, they have washed off every evidence. They have washed up, might even be 3 to 4 days or even 1 week or 2 weeks after the act has been done. So in that case, you will hardly see much.
Is there anything the hospital has in place, like a documentation process for every, when people get abused, there's supposed to be like a documentation process, apart from, of course, the medical record documentation, like a process that allows you to feed back to the system. You understand what I mean? Like, if there's going to be a prevalence or a situation or something, there should be some certain kind of records that allows you to pursue or gives you a standpoint.
How to go about it.
That's one challenge. It's not only in rape cases, even in most illnesses, basically. We have paucity of documentation, sorry to say. In the hospital, whether general or private hospital, there's no flow of documentation to the right quarters because most of the time these documents are not even being used, or the right quarters are not well aligned in such a way that you know that when you collect this document, it's supposed to go to this place, it's supposed to go to this place, it's supposed to go to this place. However, there are some hospitals that actually carry out most of the documentation you see are either the hospital documentation and maybe a letter showing the hospital documentation going to maybe a medical report, showing all the findings on the examination and everything going to the police. I don't see it going beyond that, maybe going to the welfare department, which takes it to the maybe a unit or a department that's in charge of maybe sexual abuse, or even the child welfare department. In Lagos, we have child welfare departments.
Wow, Lagos is doing a fantastic job. In fact, there's so much correlation. What's happening in Lagos, the private sector has found a way to work with the public sector, and everybody's working together, especially when they even have the sex offenders registered. Lagos has gone further than every other place.
And we need to follow.
We need to follow. Sometimes I used to think that maybe it's because most places in the north, the Child Rights Act has not been domesticated. Maybe that's why, or is it the culture? I don't know what is happening.
I think it's the culture of Nigeria. Let me come in from where a doctor said that keeping the record, they don't usually keep the record. I guess because most people don't have much reports on people coming to say my child was abused or that thereabouts. But what they usually do is the police that reported the matter, that brought the child to the hospital, they are the ones that will get those records, those examination records, those tests that were carried out on the child, on the victims. They will be the one to give those reports, those medical evidence to the police or the welfare. Yes.
Okay, the police will have to give the evidence to the welfare.
No. The police, normal. It is the police that, even if you want to pursue the matter in court, it's still the police that will take up the matter, not you, not the parents,
because it's a criminal.
Yes, because it's a criminal matter. So now, when they get the report, the work of the medical practitioners or the hospital, you just get, once you've done your carrying out the examination of the child, you give the report to the police. They are the ones to file it, or your welfare. They will still be the one to file it and then take it to the appropriate authority, which is still the police, because they are the one to prosecute that matter. So still coming in line with what doctor said, I think they are not to be documenting unless there is a situation whereby they have full, like say, on a regular basis there are reports of child
high prevalence, right?
Yes, high prevalence of child sexual abuse. But in a situation whereby in a month you get one, you might I'm giving it to the police, so let me move on with other.
Okay, that makes sense. And then I also wanted to ask, how well do the hospital staff manage the secrecy of it all? Like how do they help protect the integrity of the victim and the family? Because I remember a friend who gave her experience. She's a pharmacist. How one of her colleagues, a rape victim, came, but this was an adult, came and to get tested and everything, and then somebody came. And then that person got raped too, and the person was there. All these type of things. Do the hospitals educate? How what happens?
Yeah, it's it's normal hospital policy for the doctor-patient relationship to be kept confidential. Even the files in the hospital are confidential property, and nobody has the right to look into your file, or else you give them that leverage to do so. So if people go out of their way and do the wrong thing, doesn't make it right.
Yes.
You understand? So it's normal that the doctor should make. No, for the for the hospitals, what we do is that it's not as if you see every doctor in the hospital. There are departments that actually handle such cases that it doesn't go beyond, beyond, and the whole hospital knows about it now.
No, but this
You
was the
understand?
pharmacy.
Yeah, you
At
see.
the pharmacy.
So I don't know how it
Hospital
happened
pharmacy,
that pharmacy got to
Because there's
know
no
about
public
it.
system. We
There's
all
no
know that
public
the
Yeah,
public
you understand.
are still
So
far.
normally for the children, either the pediatrician sees, and evaluates, or the family physician, either the pediatrician or the family physician, relates with them, mostly the family physicians, because it goes beyond just talking to the child
Yes.
or
The
just
family needs
examining
to
the
be
child.
educated.
You need to talk to them. It's going to be, that. So that's why the family physicians, do what they can in collaboration with the pediatricians, to get the necessary
Sorry,
in the hospital
can
system.
your final word on a child who's what can you say or tell a parent to a parent of a child who was abused? The final word.
Okay. For the parents of a child who was abused, they are the first point of contact, because they're the ones the child look up to. How they handle it, depending on the age of the child, matters a whole lot. You understand? We've had cases that children were raped and the parents still made them feel good. They made them, know that they still have good self-esteem. All the efforts of the counselors to be on the patient parent to ensure that they don't feel stigmatized at the smallest unit, which is the family.
Yes.
Because if they don't feel good at home, of course they won't feel good about themselves in public. The fact that the child is raped doesn't reduce the child in any way. The child is still the child. The highest he loses his virginity, but that doesn't stop a child from achieving, the great goals that the child is supposed to achieve in life.
Yes.
It stops nothing.
The child is only a victim of circumstance. It's
Yeah.
only a victim that happens
So
to
that means
anyone.
they really need help. They shouldn't go it alone.
Yeah.
They should search for help, seek for
Yeah.
help. There are many organizations out there, including this one, that can help and assist with this.
And we're mostly worried, especially when the child has no parents. Maybe orphans where
Or house
molested.
helps.
Or maybe house helps whose parents are not available.
Yes.
You understand? We are particularly worried.
That drives us to there's no welfare system. And like I said, Lagos and the southern part of the country has really done so much for
Yeah.
with regards to sexual abuse. I was even going to go because I have a lot of organizations like the Mirabel Center here. They're doing a lot of work. They distribute rape kits, safe kits to hospitals. They have units, places where they refer people that have been abused because the first point of contact, getting to those places so you can get viable evidence, those kind of things are things we need to replicate. And well done to Mirabel Center, they're doing a great job. They've been there since 2013 and they've been doing a beautiful job. And so these are things we need to emulate, especially in this part where the prevalence is even higher. Where the prevalence is higher now because of course we're in the northern part of the country where to an extent the culture permits for certain children and for for certain issues with regards to child sexual abuse, like the child marriage. Child marriage is still very prevalent. It's happening every day, and nobody is being convicted for it. And with that said, thank you, doctor, so much for coming on this show. We're really glad to have you. Thank you for educating us. Thank you for educating the society. And we hope we all learned one or two things with regards to what to do and the processes involved, and of course, any last words for us?
Okay, one last, let's say one. Okay, multiple last words. Okay, once you are raped or your child is raped, please report to the police. Then ensure that if there's any delay in part of police, please rush to the hospital as soon as possible for the hospital to get evidence for you to
if you want to
prosecute the case. See, rape is a criminal offense and must be prosecuted. Report it, get help early. There's a lot of depression, social illnesses now, apart from the chronic illnesses we have. And they are killing us. A lot of our children are becoming drug addicts because of what they faced when they were children. Let's work on it now so that our children will live a socially free life. Report these cases. Let us bring justice to these people who perpetrate this thing, because it's becoming very prevalent now.
Well, thank you so much for being on this program today. We hope you learned a few things on this program today. Thank you so much. And of course, we still plead with organizations that are reaching out there, distributing rape kits, or aiding people in various ways, just like they aid people in HIV, giving drugs. Please, let's aid with rape kits. Let's reach out to people and equip more places that people can reach out and get help. Hope you did learn one or two things today. And we hope to see you next week again on You Are Not Alone.